A young man starts to feel unwell. His head has started to ache and he's got the chills running through his body. He's found it hard to focus and he's beginning to get tired ever since lunch. He leaves work early only to be greeted by vomiting when he gets home. A few days later, bumps begin to form on his skin. He checks himself into the local ER to be diagnosed with smallpox, like this guy here. Many believe that vaccines are unsafe. Today I want to share with you what vaccines are, how they're made, and talk a little bit about their effectiveness and safety. The story I shared is fictional, but it could easily be a reality if people stop getting vaccinations. What is a vaccine? Most of us know that a vaccine is a weakened or inactive virus put into a serum and injected into the body. The virus is then attacked by our immune systems and our body learns how to defeat it in the future if we come in contact with it again. But how is a vaccine made? According to an article from the Children's Hospital of Philadelphia, there are 3 techniques that are most common, and I'm just going to cover them briefly. The first way is to weaken a virus. This is done to make sure that the virus reproduces very little or not at all when put into the human body. Second technique is to inactivate the virus. This is done with several different pharmaceutical chemicals. And lastly, can use a certain part of a virus, the DNA structure, coupled with a special protein. Pharmaceutical companies make many vaccines with these simple techniques to defend from viruses every day. But most of the debate about vaccines is how they're made, although many people question their safety, even though vaccines are highly safe. Vaccines contain chemicals such as formaldehyde, mercury, and aluminum. These chemicals are used to preserve the virus inside the vaccine or prevent contamination from other antigens, which would cause sickness when injected into the body. According to the Food and Drug Administration, formaldehyde in a newborn baby's body is 50 to 70 times higher than any single dose of a vaccine they could receive or any subsequent vaccines. They also say that vaccines don't cause any lasting side effects because the chemicals within them are so minimal. In fact, the human body naturally creates formaldehyde through different cell processes. And the amount of formaldehyde in a vaccine is very minimal compared to what the body produces on its own. In my research, I couldn't find any numbers about people who had died from receiving vaccines. Rather, the number of people who die worldwide from preventable diseases is extremely large. In 2002, the CDC reported that 540,000 children had died from measles, which is a preventable disease with a vaccine. You can see from this chart that when measles began being administered in 1963, the number of reported cases dropped off significantly. Dr. Howard Koch, the Assistant Secretary of Health for the United States Department of Health and Human Services, remarks that millions have received the flu shot and H1N1 vaccine without any adverse side effects. He also goes on to state that the FDA maintains the highest safety standard for vaccines and tracks any side effects reported by users. Many people forget that vaccines have many benefits. Stanford Health, a reputable health organization, reports that vaccines help reduce the spread of disease to others. In essence, this prevents epidemics. Without vaccines, epidemics like a flu epidemic could easily occur, and those without the proper vaccine could get sick, or many people could die and live with debilitating side effects like that caused by smallpox or polio. The Public Broadcasting Station, or PBS, had an article that talked about a flu epidemic or outbreak. If schools had to close for 4 weeks, this could cost the American economy up to $47 billion. Flu.gov, a website by the United States Department of Human and Health Services says the best way to prevent the flu is to get a vaccine. Vaccines are very cost effective. They're fairly simple to get. You just get a shot in the arm or a nasal shot in the nose, and they're very cheap. As compared to staying in the hospital for a week because you didn't get a vaccine, and it could end up costing you thousands of dollars as well as missing a few weeks of work. Also, vaccines have very few side effects. At most, people experience minor swelling or pain at the injection site. With the nasal flu, like I received, you might get stuffy in the head and feel a little sick for a day or two, but these are both small prices to pay. You notice a classmate who's been coughing and sneezing and had a really runny nose during class. You don't see them until the next week, and you realize that they had the flu for the last 6 days and missed a lot of classwork. Good thing you got your flu shot. Or did you? Many arguments about vaccines have been blown out of proportion, and there's a lot of false data circulating about them. The FDA maintains the highest levels of safety regarding vaccines. And vaccines protect millions of Americans against the flu and H1N1 while maintaining low side effects. Without vaccines, many people could die from a large epidemic, even the flu. And all of it could be prevented with a simple $10 shot. Isn't human life worth at least that much? Are you running out or what?
Yep.
Oh.